So for the next topic, I would like to invite Dr. Sanjeev Rao, Senior Consultant Physician and Diabetologist at Manipal Hospital, Bengaluru, and Dr. Satish Kumar C, Consultant Psychiatrist at Manipal Hospital, Bengaluru, and Dr. Neha Parashar, Clinical Psychologist. We welcome you, doctors.
Good evening, everybody. This is a topic I'm sure will interest all of you, and this is one of the reasons why the entire event has been named as CPD, and this is one aspect we have to understand, that this applies to all of us. And it's a well-known fact that doctors die young, and Pavana will help us. She is a consultant psychiatrist, child and adolescent therapist, practices sexual medicine at the Akshay Medical Center in Bangalore. Over to you, Dr. Pavana.
Yes. Good evening, everyone. Thank you, Disha and Dr. Manohar, for making me part of this summit. When I was coming, I was having a discussion outside. One of the doctor was telling me, I think, Dr. Pavana, you should, instead of keeping the topic name as why do doctors die young, he was telling me, suggesting me, do doctors really die young? So I was, kind of telling him, so this is what we always think about ourselves. So let us move on to know about whether this is the right thing, why doctors die, or do doctors really die? So, outline of my topic would be, what does Indian statistics or a global statistic would say regarding this? Are there any researchers included in this topic, or what are the contributing factors? What are the other stress or burnout or neurobiological issues involved in it, and health consequences of a stress? Suicide, which is a major thing, which is a very important thing, which we usually ignore or we do not discuss at all. And are there any risk factors or warning signs regarding this? Then how do we manage it? We all know that life expectancy is something about a measure of an average number of years a person can expect to live based on their age, birth, or demographic factors. Now we can see here the global trend says something else, whereas in Indian statistics says something else. Though it is for a general population, it is an average, it is lesser in an Indian population. When I was going through, when I was researching regarding this topic, I was really shocked and perplexed, because the whole data about it spoke about almost about an average of 55 to 59, 58 sometimes. Seeing whether male or a female, it is more or less the same. Again, coming back to the cause for mortality, it is again cancer, suicide, or a heart disease, or an infection. It is the same as such. And also, stress was a major contributing factor for an early deaths. One was a specific mentioned, which is called as an VIP syndrome. Most of the time we are in the desk job, a sedentary lifestyle, lack of exercise, and obesity. It holds good for even for a general population, but it is more or less impacting more for doctors because of a stress which is involved in their workplace. Now when we put it across with the specialty, I would say the studies shows that emergency medicine physicians have a much more of a shorter lifespan rather than comparatively to the primary care physicians. When we see here, stress and burnout is very common. No matter you take any profession or anyone for that, everyone goes through some amount of stress in their lifespan. But comparatively to the general population, to the physician globally, it doesn't make much of a difference. But when we come across with the Indian physician, it's much more higher, almost crossing more than 50%, it is 60% to it. You all might have, when we were registering, there was a small survey which you filled. So I think most of you, we got almost about 71. This is nothing to do with any scientific data or anything. It is just for a comparison what we did, whether people sitting in the same hall, it is anything correlation between what we were speaking as a statistics in a general or a global population. You can see here in the left hand side, here, experience and age profile. When they start practicing earlier, it is all about the struggle about building your practice, the stress level is higher. Does the stress level decrease over the practice of 20 years or 30 years of your practice? No, it does not give you any immunity towards it. It is still the same, but it is in a different angle. So, and also, age also matters, and also, it is worn and torn about the after work. There is no coping mechanism which is involved basically. The most of the stress were not coming from an external factors, but from a work and then internal factors. Now, what are the contributing factors to it? One is work-life balance. We all as a doctors work for hours together, 60 to 80 hours per week, and consistently patient high load. When you increase your practice level, it is very, very difficult for us. We find it very difficult to say no to our patients, right? Even at 11 o'clock in the night or whatever it is, we attend ICU calls. We do, even on the holidays, we do not switch off. See, all these things is a work-life balance which is hampered. Does that have any impact on a mental health? This is the mental health dashboard. Whereas globally, as a general population, what we see as a prevalence for a depression or anxiety or any other mental health issues, much more comparatively, it is much more higher in a doctor population, where almost about 35 to 40% as a depression, anxiety levels are too high, or even having a suicidal ideation at some point of time is much more prevalent. Is it just that stress or an external factors which is contributing? No, occupational hazard. We also carry an occupational hazard. I do not know whether to call it a hazard of a violence against the doctor, but it comes along with it. Radiation or a sedentary lifestyle or obesity. Now you can see the same thing happens. It also leads to the physical health toll, where we were already talking about the cardiovascular issues. So it also impacts on the physical health. Is it so that only the physical or occupational hazard only involves with the patient perspective? No. If you are supposed to be starting with the practice or anything, it's a lot of other things which comes tagged along with it. One, having kind of legally aligned with it, having a regulatory the acts in line, protective or a safety. Doctor was mentioning about the indemnity and everything, and the labor law, and the most difficult part is the legal or a punitive factors which is contributing to it. Again, coming to the specialties, what difference does it make? It is only the emergency medicine, or this is should just have a check on how much is the gap of the burnout or a stress comparing to the specialty. It is much more higher in when you are having to take a decision at the drop of your hat, or you have to be available at any point of time, the expectations of the patients, all these things matters so much. But they never get into the fact of that I might also have a burnout issues. Acknowledging that is what is awareness about it is what matters the most. Does all stress lead to kind of risk with the life? No, not exactly. Stress everyone goes through. It's an acute phase where we all have some amount of an exposure to it. We react to it Fight and flight response, we know about it. If we do not develop some amount of coping mechanisms, then it leads out to a burnout. It is called as a depletion phase, where we exhaust with the resources what we have. Then leads to a systemic failure. That is where endogenous depression, what we talk about. It need not have to be reactive. It need not have to be going through a lot of stressors in life, or there has to be some event to say I am depressed. We know there is a neurobiological cause for having a depression. So systematic inflammation. This is one of the study which was in an Indian Journal of Psychiatry in 2018, where they analyzed what was their coping mechanism. 90% of the time who were having a burnout never had any recreational activities, which is very, very unfortunate among the doctor professional, because we sign up to increase the life expectancy of patients whom we treat, but we don't take care of ourselves. 67% of them had an exposure to the verbal or a physical abuse, or 30% of them have a lack of support system-wise. Coming to the neurobiological of the any distress, we know how prefrontal cortex is more important to us in managing our decision-making abilities. Whenever there is an exposure to the chronic exposure, there is a cumulative stress which is involved, our functionality decreases. There is an optimal functioning which we say it drops down under the stress. And there is an increased mistakes or medical errors which happens. Like what doctor was mentioning earlier in the talk, that we make medical errors, decision-making abilities, there is no documentation of what needs to be required. See, all these things happen if we are not able to tune up with that. Are there any health consequences associated with that? Of course, yes. Cognitively, it can lead to a major depressive episode, anxiety, memory issues, endocrinologically, cardiovascular or immune system, all the system get compromised with it. Coming to the very important, this I always raise an alarm in any talk I give, because you can see here the amount of a higher suicide risk is what I'm talking about, is much more higher in our profession rather than comparatively to another professions. And also there was one of the studies which was done among 64 MBBS or 55 post-graduation medicals died of suicide in the last 5 years. These were the study which was done in a JSS. So you can see here, highest risk specialties when we take of the suicide risk, we know all these things, but we do not keep ourselves or involve into the coping mechanisms, what best we can do about it. Can we recognize this? Can we recognize who is vulnerable to it, or is there any risk factors to it? Because we all say as a professionals, we see that I enjoy my work, I enjoy working for a long durations, I enjoy whatever the stress, it doesn't make me feel stressed. So when can you recognize that it is so? At some point of time, our body and mind says, it's all good, I can work. But the moment there is a giveaway, it is not the sudden. It is over years of the burden which has been taken on. Again, it could be also an additional to any of the personal or an individual factors, a marital conflict or financial stressors. All these things leads to the risk of having a suicide. And you can see that whenever there is a too much amount of a burnout or any amount of a mental turmoil, what we go, almost medical errors are 95% of the time. Suicide warning signs, how do we recognize it among ourselves, among colleagues, friends, families? One is talk to them, take a time off, take holidays. Are you able to recognize that is important? Any changes in the behavior, increase in alcohol or drugs, or sleeping too much or too little, or any change in the mood issues will lead to, this is what the warning signs are. When there is a stress, what happens? Why someone has to think about suicide? Is there any reason to it? Life is so beautiful, so why someone has to get into the tunnel vision of it? We are very vulnerable. There is some diathesis which goes on. Adding on to the vulnerability, there is an HPA axis which the changes which happens. There is a gene expression. There is a leading to vulnerability to psychiatric disorder. It need not have to be, but they are vulnerable towards it. When there is a vulnerability, there is an epigenetic modification which happens. That is where the stress and trauma adds on to it, leading to a tunnel vision where they see there is a psychological pain which there is no way getting out of it. So smallest of the smallest issues, they start perceiving it to be seeing it in a magnifying glass. So this is where they are again, they are more vulnerable, they become isolated, loneliness, all these things acts on to the contributing factors to it. So what do we do with that? So if there is, yes, my working hours are more or whatever it is, so how do I manage it? One is personal care and the institutional or organization reform. So what do I do? Lifestyle changes, which has been talking all along the whole day, because you also had in yoga sessions. 30 minutes of exercise per day is mandatory, 5 minutes of deep breathing exercise. Most of the time when I see clients in my practice, when I say this, 5 minutes of a deep breathing technique or an kind of exercise and all, doctors say, yeah, I know all these things. Yeah, I know I have to be active. I know I have to relax. Do you do that? That's what matters. No, I don't get time. So I think if we don't make time for ourselves, no one else would. Then prioritizing the tasks, scheduling a specific time for a workout or the rest, social support, family, colleagues, hobbies, outside of your workspace, what you can do, what matters the most. Recognizing the signs of stress or a burden. Stress or a burden, if someone else is recognizing, it is beyond the limitations of the self. That is where you start having that behavioral changes in you, like an increase in the alcohol use or an snapping at people or having an outburst, having a marital conflict. All these things comes later on. First is the sign where you have to recognize by yourself. That is what matters the most. Then there is an institutional where workplace environment, manageable demands, support, then employee assistance programs, then training, education, having an awareness program, I think good environment. The most of the time when I used to earlier work in an institute, I used to see that doctors or anyone don't step into the psychiatry OPD. It's very, very stigmatizing. For them, what people, others think. So that is what is our, I think if we being as a medical professionals, we don't break the stigma, no one else would. Last take-home message is the reality. We have to accept the reality, what it is. We are functioning in a very, very high stressful environment, working for a long hours or a high responsibility or emotional exhaustion. This is where we need to have a check on. And what are the risk factors? Am I vulnerable to it? Having a family history of any psychiatric issues or psychological issues, then how do I take care of myself? Systemic impact. If I'm being diagnosed with a diabetic or an hypertension or whatever it is, what am I working on? That's very important. And prescription of survival is nutrition, sleep, and having a boundaries. This is enough for me. Who draws the boundaries? Only the self. Then doctors must prioritize their own mental health, breaking the stigma to seek a help when needed. Thank you all for patience hearing. Now the house is open for discussion. Thank you.
Now I'll request Dr. Satish, who is our clinical psychologist at Manipal, to say a few words.
Thank you, ma'am. That was a wonderful talk. Yes. I sometimes wonder, is there a adverse childhood reasons, like a person who is probably from poverty or someone who is struggling with finances, with parental issue? Is there a linear equation somewhere like the whole concept of childhood and people growing to teenage years and then becoming a doctor? are these people who have an adverse childhood effect, do they grow into becoming hard workers? Do they not really take care of themselves? It becomes a race for them. Could that be one of the
So,
possibility?
yes, that could be. It is, what you are deprived of as a child. Now you start having that, you want to fulfill that. I see a lot of clients who say that, no, I was deprived of, lot of things when I was as a child. Now I want to buy everything for my children. It could be expensive watch or whatever the child wants. So now this is what, and now I see a lot of clients like that, where they say that I wanted to be a dancer, but I could not. Now I want my child to be. But you never ask what the child wants. So this definitely impacts of how we have been brought up or our mindset.
So there's no milestone. They want to keep reaching more and more and more. They don't know where to stop or slow down.
Yes.
And also another possibility of personality. Probably if there are people with OCP where they have a lot of need for perfectionism, being very meticulous. Again, there is no milestones of celebration. They keep reaching for mountain, then sky. So if there are personality possibilities too, who develop chronic disease.
Yes, type A personality is what we see most of the time, where they're not satisfied with anything. There is nothing called as a boundaries for them.
And also we did I think world's biggest study along with Manohar sir. The publication shows that gender differences exist. I think you have anything to talk about that, ma'am, like gender, male and female, in terms of chronic disease or how they are.
So one is, yes, the coping mechanisms. Women usually tend to ignore the fact, whatever the physical issues they have, they keep postponing and not taking care of the health. Their own health is what they usually take a back seat on. Yes.
Thank you, ma'am.
Just to conclude, first thing is that you have to set your own pace of working. You cannot compare yourself to the person next door to you, because once you do that, you will be under stress. Second thing is, you please don't keep sitting on a chair. The simple thing is, after you see each patient, please escort him to the door and come back. That little bit of walking will somehow get you going. Otherwise, you are going to sit for 12 hours, 8 hours at a stretch. Third thing is that there is no harm in taking a break. Tell the patient, I want to have a cup of chai. Have a cup of chai for 15 minutes. Nobody will say no. Tell the patient, I'm going to break for lunch. All Indian patients will say, please doctor, have lunch and come. You are not trying to be a hero by sacrificing your health, because if you fall ill, he is not going to come and help you. So, simple things. And you have to decide when enough is enough. You have to decide to pull the shutters down at one particular time of the day and say, the clinic is closed. Please come tomorrow. If he is going to trust you, he will come. If he is not, he is going to fish in every pond he gets. Okay? Plan your day so that you get enough time to read, enough time to exercise, and get a good night's sleep.
Thank you.
Thank you very much.
I'll have to add something or ask you a question. Is it time that we should change the word stress to distress? I was, I remember one of the, when I was very young, once upon a time, one of the retired ICS, he was a pre-Independence Day fellow. He said, Doctor, do you know there are two types of stress? I'm sure your physiology has taught you.
Yes, yes.
I love my wife. It's stress? He said, yes, it is eustress.
Yeah, yeah.
I don't love my wife, I hate her. It is distress.
Yes.
So you have been talking about distress. It is time we have to change it to distress.
It is mistress, sir. It is mistress.
Thank you so much, doctors. One thing I take away from this talk is we cannot pour from an empty cup. So, thank you so much, doctor, for enlightening us. I would request the chairpersons and the speaker to move towards the selfie area for the group photo.